So we discussed, लोग late आए हैं, treatment of diarrhea, and it's over now. We are late. Topic completed. You happy? We discussed about no. Close the door. So we discussed about the antidiarrheal agents. It includes what we discussed right now is ORS. ORS is not an antidiarrheal agent. It will help in the dehydration. It is associated with the diarrhea. And we discussed about the antibiotics. Ofloxonidazole and loperamide. It is a opioid agonist. We'll discuss some more drugs. We'll add on to it. So that we'll add on to what we know already. Okay. So first of all, diarrhea. What is diarrhea? Diarrhea is, when you call it a diarrhea, it should be 3 or more loose or watery stools in 24-hour period. So if the stools are less than 3, then it is not diarrhea. And if 3 or more than 3, then also we'll take into consider the consistency of the stools. It should be loose. A patient can have motion 3 or 4 times a day, could be 5 times a day. That might not be diarrhea because the stools are properly formed.
Sorry, sir. Just won't repeat, sir.
Sorry won't help. हमेशा लेट क्यों आते हो? पहली बार है आज. और है? आएंगे अभी?
तो बात करो.
Close the door. Close the door. Don't disturb the class. So we are discussing 3 or more loose stools in 24-hour period. Fine, that is called diarrhea. Patient can have 3 or more stools that are not loose. What it could be? He is going to motion 5 or 6 times a day, but the stools are not loose. क्या हो सकता है? Any guesses? Give me a wrong answer, but give me an answer. Laxative abuse can be, or there is a disease called IBS, irritable bowel syndrome. That could be. Read about it. Okay. Then causes of diarrhea. Excess water in the feces can be due to water ज़्यादा क्यों होगा? Can be due to decreased absorption, increased secretion. Can be due to inflammation of the mucosa that causes increased secretion, or can be due to increased osmotic load. Increased osmotic load. That means when you have high solute concentration in the intestine, it may also cause diarrhea because of the osmosis. Because concentration अगर ज़्यादा होगा intestine में, the fluid will get absorbed from the plasma, and that will also cause diarrhea. ठीक है? So if we'll take food with high sugar or with high osmotic load, then it may also cause diarrhea. You must have read about mannitol. Mannitol causes osmotic diarrhea. Mannitol is an osmotic diuretic also. It causes decrease in the cerebral pressure in the case of hemorrhage. So, it also causes osmotic diarrhea by increasing osmotic load. Some relevant physiology of the intestine. Water and electrolytes are absorbed as well as secreted in the intestine. Jejunum is freely permeable to salt and water, which are absorbed secondary to glucose and amino acids. Glucose and amino acids are absorbed along with the water in jejunum. Then we have sodium potassium ATPase in the ileum and colon. What it does? Absorption of sodium, and to maintain the electron neutrality, we have to give up a cation. Sodium absorb हो रहा है तो potassium is lost. ठीक है? That is a pump that needs ATP to work. That is active transport. ठीक है? Sodium जब भी absorb होगा, water is absorbed along with it, because to decrease the osmolarity of the fluid, or low osmotic fluid absorb होगा साथ में. ठीक है? Always remember, water always follows sodium. Whenever there is sodium absorption, there is water absorption also. In addition, glucose facilitated sodium absorption takes place in the ileum by sodium glucose co-transporter. In the ileum, there is a co-transporter known as sodium glucose co-transporter that causes absorption of glucose along with the sodium. Then sodium is absorbed and potassium is also lost along with the absorption of sodium in the intestine. A condition called disaccharides deficiency, which occurs during starvation. What happens in that? Disaccharides, which is present in the brush border of the luminal cells, it is absent. In the case of starvation also, it decreases. So, disaccharides जो है, that will remain in the intestine, not metabolized, that causes increase in the osmolarity and increase in the stool volume. That may also be a cause of diarrhea. But in the case of rotavirus, inhibition of the sodium potassium ATPase pump that I have told you, sodium absorption नहीं होगा, तो sodium के साथ में water absorption भी नहीं होगा, and there will be loss of fluid in the intestine. And stimulation of the CMP or CGMP. What that does? Net loss of salt and water. Increase in the CMP causes loss of the chloride, and sodium is also lost along with it, and water is also lost along with it. CMP is stimulated by some bacteria and bacterial toxins. Example: enterotoxigenic, E. coli, Staph aureus. माइक्रोबायोलॉजी में आया आपके? आ गया ना? So it causes loss of water, and that could be a cause of diarrhea. Diarrhea may we give ORS. That is a standard composition of the ORS. We also use home-based ORS, rice-based ORS solutions that have protein, which stimulates the absorption of salt and water. I have told you amino acids also stimulates the absorption of sodium. So increase in the protein causes absorption of the salt and water along with it. Then ORS कब यूज करेंगे और कब हम IV fluid देंगे? When there is loss of more than 10% of the body water, then we give IV fluids. ठीक है. और जब it is less than 10%, then we have to give oral rehydration therapy. So in the cases of mild dehydration, when there is not much loss of fluids, कैसे पता पड़ेगा जरा सीवियर डिहाइड्रेशन है या माइल्ड है? Someone comes to you and you see the patient. How can you say that he or she needs IV replacement rather than oral replacement, or the vice versa? Concentrated urine. पेशेंट को देख के कैसे पता पड़ेगा concentrated urine आ रहा है उसको? Any symptoms should ask for? Excessive thirst, lethargy, dry mucous membrane, skin turgor. That are the symptoms that will help you in the diagnosis of the dehydration. And if there is severe dehydration, that you can see by, or you can ask the patient कि मुंह तो नहीं सूख रहा, and पेशाब में जलन तो नहीं आ रही, because it will also cause burning micturition. So by these symptoms you can start, and you can make a note of that you have to start with the IV or oral rehydration. ठीक है. तो if less than 10% of body weight fluid is lost, then we'll start with the oral, or else we'll start with the IV rehydration. ORS देने से क्या होता है? Why ORS? Why glucose, sodium along with it? Electrolyte balance, and as I told you, yes, you. क्या हो रहा है? आ गया दोनों? ग्रीन शेड के पास वाले दोनों? कहाँ तुम दोनों? पीछे? नो. तुम भी? क्या हो रहा था? आ गया? नहीं? प्लीज क्लोज इट. इधर आओ, इधर आओ. लेके आओ उसको. क्या लिख रहे थे उसमें? हाँ? कर क्या रहे थे? नीचे मुंह करके चौधरी. और क्या लिखा है इसमें? कौन सा पेज? यही था. तो नीचे क्यों कर रखा था हूँ? हाँ, फोन खोल रखा था. फिर क्यों बैठे थे ऐसी? क्लास है तो ऐसे ही बैठे थे क्लास में. बैठो, यहाँ बैठो ऐसे. वैसे बैठो. So we are discussing about ORS, glucose, electrolytes. ठीक है, replacement is there. Glucose also increase the absorption of sodium along with it, so we add the glucose. But there is a lacuna. If we are giving the glucose along with it, there is a harm, because glucose also causes osmotic diarrhea. So we have to decrease the concentration of the glucose. So earlier, the ORS which we are using, we have to decrease the concentration of that so that osmotic diarrhea will not be there. So instead of giving ORS to help the patient, we are increasing the osmotic diarrhea. So in the new ORS, we are giving hypoosmolar. We have decreased the concentration of the glucose to hypoosmolar, or isoosmolar, but not more than the concentration of the plasma. ठीक है? So in the new formula of WHO ORS, we decrease the concentration of glucose to between 60 to 110 millimole. Earlier it was around 180 millimole. Fine. Then how to give oral rehydration therapy. ORS should be given at half to 1 hourly interval. Initially 5 to 7.5% of body weight is to be replaced. बहुत सारा एक साथ नहीं देंगे. Initially 5 to 7.5% of the body weight is to be replaced. ठीक है? उसके बाद what we do is we have to give ORS according to the stool. Replacement के बाद हम overdose नहीं करेंगे. We'll give according to the stool. अगर patient को दिन में 6 stools हो रहे हैं, so we'll give the around 200 ml of ORS with each stool. That will not cause the overload and cause the replacement. In a weak child who is unable to drink ORS, we can give them by the intragastric drip. Or what is intragastric drip? What it is? हाँ सही बोला. Direct stomach with the help of Ryle's tube. It's a nasogastric tube. We enter it through nose, it moves to the stomach, and we can give the ORS through it. ठीक है? It is also used in the case of comatose or unconscious patient to prevent the aspiration. So as I told you, ORS is not to treat the diarrhea. It is to replace the fluids and to prevent the dehydration. Then we also give zinc. क्या हुआ? हंसी क्यों आ रही है? नहीं हाँ, white shirt near red shirt. अभी कंफर्म हो गया? हाँ, क्या वो हंसी क्यों आ रही है? नहीं पढ़ के डायरिया हो गया क्या? ओरल डायरिया. So zinc. We were also using zinc in. Recently we are using zinc, a lot of zinc. Zinc tablets we have been taking for what? The disease recently we are taking a lot of zinc. COVID, yeah, COVID. In COVID we are taking zinc tablets. So zinc reduce the fluid secretion. So below the age of 6 months, we give around 10 milligram per day of zinc, and above 6 months to 5 years of age, we give around 20 milligram per day of zinc in the case of pediatric diarrhea. It has an adjuvant role, not much proven, but reduce the fluid secretion. So we give it to the children. Not of much use as such. Not also in the COVID. ठीक है? So specific treatment now. Specific antimicrobial drugs, as one of us told, Oflox OZ, that is an antibiotic, and probiotics we give क्या होते हैं प्रोबायोटिक्स? खाए सबने? हाँ, याकूल्ट और स्पोरोलैक, एंड्रोजर्मिना, they all are probiotics. And drugs for IBD, inflammatory bowel disease, and non-specific antidiarrheal drugs. So diarrhea is caused by, if we're talking about the infective diarrhea, mostly called by Salmonella, E. coli, Shigella, Clostridium, toxins, and anxiety also causes diarrhea. Some drugs also cause diarrhea. First of all, we'll give anti-motility drugs which prevent the or decrease the motility of the intestine. ठीक है? It decrease the peristalsis and decrease the movement, so more absorption of the fluids and decrease in the diarrhea. We give opioids like diphenoxylate, loperamide, diphenoxine. Loperamide is most commonly used. Lomotil is the brand most commonly used. We give, start with the 2 milligram per day, increase it to 4 milligram. Maximum dose per day is 16 milligram per day. It can be given. Opioid hai, so acts like opioid, acts on the mu, kappa and delta receptors. Mu receptors causes decrease in the intestinal motility. Delta causes decrease in the secretion, and mu and delta receptor also causes decrease in the increase in the intestinal absorption. So causes constipation. As we have read, the important side effect of opioids is constipation. So we are using that side effect to have an effect. Okay. It also increases anal sphincter tone. So that is also a mechanism behind diarrhea. It is also effective in traveler's diarrhea. Traveler's diarrhea is an infective diarrhea. Usually happens in travelers. आजकल इतना कॉमन नहीं है. Earlier people used to travel long distances and they take multiple stays. So it usually spreads by water and food, infected water and food. So earlier it was very common. It is due to infection, most commonly by E. coli, and we can also use loperamide in this diarrhea. Usually we don't use loperamide in case of infective diarrheas. Why? We don't use loperamide in case of infective diarrheas. GI motility, तो क्या करेगा? उससे क्या होगा? बैक्टीरिया या बैक्टीरियल रिटेंशन होगा. अगर स्टूल्स पास नहीं होंगे तो इट विल कॉज बैक्टीरियल रिटेंशन. रिटेंशन होगा तो बैक्टीरिया विल प्रोपोगेट और इन्फेक्शन फ्लेयर अप हो सकता है बहुत ज्यादा. It is usually avoided in case of infective diarrhea. It can be given in the case of secretory diarrhea, where there is no infection at all. So, do not use loperamide, as I told you. Patient with bloody diarrhea, high fever, systemic toxicity, मतलब infection है कहीं पे. High fever है, systemic toxicity है. Worsening diarrhea despite treatment. अगर डायरिया फिर भी वर्सन हो रहा है डिस्पाइट ट्रीटमेंट, सो यू शुड स्टॉप इट. अवॉइडेड इन चिल्ड्रन बिकॉज इट कॉजेस ओपियोइड्स कॉजेस रेस्पिरेटरी डिप्रेशन, सो अवॉइडेड इन चिल्ड्रन. इट मे ऑल्सो कॉज टॉक्सिक मेगाकोलोन because of the flare up of the infection in the intestine. Toxic megacolon is an emergency and it is to be treated immediately. It may cause sepsis and death. It is fatal condition. So contraindicated in children less than 6 years old. Then Resicadotril. It is used commonly. It is an inhibitor of encephalinase. Encephalinase degrades the enkephalin, and enkephalin is increased, which acts on the delta receptor and which is anti-secretory. So basically Resicadotril prevents the secretion in the intestines. ठीक है, secretion कम करेगा. Resicadotril is anti-secretory agent. Comes with the name of Ridotril, 100 mg. You have to give it thrice a day and can be given for 2 to 3 days according to the diarrhea severity. ठीक है? It is not contraindicated in infective diarrhea. It can be on infected diarrhea. So अगर पेशेंट को बहुत ज़्यादा सीवियरिटी है डायरिया की तो it can be added. But usually what we do is we give symptomatic treatment in the case of diarrhea. ORS is mandatory. ठीक है? Food changes is mandatory. Ask him to take what? What food changes are recommended to the patient? Banana and rice, milk. Milk? No. Curd. So lifestyle is important. Ask him to take the curd, rice and banana. Why banana? Easy for digestion, fiber. Apple can also be taken. Potassium, right? Potassium. Banana has got potassium, so it provides the electrolyte also, and potassium normalizes the intestinal motility also. Okay, so it is good in the case of diarrhea. So Resicadotril can be given. Bismuth subsalicylate, not given as such. It combines with HCl in the stomach, form bismuth oxychloride plus salicylic acid. It has got anti-inflammatory, antibacterial, anti-secretory effect. क्या हुआ? Caldwell? What happened? Then go out. Give me a roll number. Go out. क्या हुआ? वॉमिटिंग हो रही है? चक्कर आ रहे हैं? हाँ? नॉइजेटिंग लग रहा है? You can move out. Give him some water if you're having. ORS. आती है आवाज? ठीक है? You okay? So bismuth subsalicylate not commonly used. It has got anti-inflammatory, antibacterial effect also, anti-secretory effect, but not used. Antimicrobial used in the diarrhea, irritable bowel syndrome, celiac disease, pancreatic enzyme deficiency, tropical sprue, thyrotoxicosis. No antibiotic is required in these cases. Thyrotoxicosis due to increase in the motility. Tropical sprue due to the mucosa. Pancreatic enzyme deficiency due to deficiency in the pancreatic enzyme, so less digestion and malabsorption. Celiac disease due to allergy to allergy Gluten, wheat, rye, barley. It causes damage to the mucosa and causes malabsorption. So diarrhea due to malabsorption and irritable bowel syndrome. There is no defect in the mucosa in the case of irritable bowel syndrome. It is just increased motility due to anxiety. Irritable bowel syndrome cannot always have diarrhea. It can have diarrhea, it can have constipation alternating off and on. Then traveler's diarrhea, mostly due to enterotoxinic E. coli, Campylobacter, or could be due to virus. Cotrimoxazole, norfloxacin can be given. ठीक है. Rifaximin, not usually used, can be given. Enteropathogenic E. coli, cotrimoxazole और फ्लोरोक्विनोल कैन बी गिवन. कैसे पता पड़ेगा ये कौन सा है इन्फेक्टिव एजेंट? किसी पेशेंट को डायरिया है, कैसे पता पड़ेगा कौन सी दवाई देनी है? कैसे दोगे? शिगेला डायरिया में ये देना है, इसमें ये देना है. हाउ यू नो? कैसे पता पड़ेगा कौन सी ड्रग देनी है? ऑल डायरिया, ऑल इन्फेक्टिव डायरिया. Should go for stool culture and see the culture sensitivity. ठीक है? So accordingly we can give the drug, because usually in modern treatment guidelines what we do is there are no guidelines as such. We give the stool for the culture sensitivity and we get the sensitivity. So according to sensitivity to the antibiotic we can start with the drug. That's it. So cholera mein we can give cotrimoxazole, Campylobacter jejuni, norfloxacin, Clostridium difficile. Causes Clostridium difficile causes pseudomembranous enterocolitis. What it is? It is a super infection in the intestine. When we give the antibiotic, it causes pseudomembranous enterocolitis caused by Clostridium difficile. Super infection means one bacteria is propagated and all others are suppressed. So it is mainly due to clindamycin, pseudomembranous enterocolitis, and in this there will be diarrhea and there will be formation of a membrane in the particular area of the intestine, damage to that area and formation of a membrane. That is pseudomembranous enterocolitis. Drug of choice is metronidazole, and if it doesn't work then we can give vancomycin. ठीक है? For amoebiasis we can give metronidazole. Diarrhea due to blind loop or diverticulitis may be treated with metronidazole. Blind loop or diverticulitis क्या होता है? पढ़ना है इसको. Blind loop and diverticulitis. क्या नाम है तुम्हारा? वाइट शर्ट. क्या नाम है तुम्हारा? खड़े हो. राहुल सिंह. रोल नंबर 80. बैठ जाओ. ठीक है. Then we can give probiotics. Probiotics are healthy bacteria given to propagate the healthy bacteria and suppress the growth of the harmful bacteria. ठीक है. So like usually we give lactobacillus bifidobacterium. One brief about the IBD. We have some time left. IBD is, there are two IBDs. Irritable bowel disease and inflammatory bowel disease. Both are different. Irritable diarrhea is due to irritation of the intestine. Patient is irritable. That may cause diarrhea. It is a psychiatric disorder. And inflammatory bowel disease is actually inflammation in the intestine. So we can give the antidepressant and the symptomatic treatment in the case of irritable bowel syndrome. But in the case of inflammatory bowel disease, there is actual inflammation. So we have to treat the inflammation by anti-inflammatory drugs. दो तरह के होते हैं, ulcerative colitis and Crohn disease. You must have read about that in pathology. पढ़ा है pathology में? पढ़ लिया? नहीं पढ़ा? अभी हुआ नहीं आपका? So read there. Ulcerative colitis and Crohn disease. Both are having inflammation of the intestine due to the autoimmunity. It damages the intestine because of the inflammation. ठीक है? There will be lesions in the intestine. In Crohn disease is more severe as compared to the ulcerative colitis. There can be transmural inflammation of the intestine and there can be strictures and perforation of the intestine in the case of Crohn disease. Drugs used are anti-inflammatory agents. We can give 5-ASA, which is mesalamine, corticosteroid immunosuppressants and TNF-alpha inhibitors. Just name of the drugs. We can give sulfasalazine, which is an anti-inflammatory drug, belong to the NSAIDs. It suppressed both the COX and LOX. आपके NSAIDs हो गए ना? COX and LOX means cyclooxygenase and lipoxygenase pathway both are inhibited. So inhibit the formation of prostaglandins and leukotrienes, inhibit the inflammation and thus suppress the disease activity. ठीक है? Mainly used in the remission. ठीक है? To maintain the remission. तो अगर फ्लेयर अप होगा तब यूज नहीं करेंगे. फ्लेयर अप खत्म करने के बाद we can use it to maintain the remission. Flare up में remission में we have to use the dose 3 to 4 gram per day can induce remission but not usually used for the remission. Corticosteroid use करेंगे and to maintain the remission we give 1.5 to 2 gram per day. Mesalamine, it is 5-ASA, 5-amino salicylic acid, and it is not used as such because it has to be acted in large intestine and it gets destroyed into small intestine only. So we have to give coated 5-ASA so that it can reach the large intestine. It is known as mesalamine. Daily doses 2.4 gram found to improve the patients. We can also use 5-ASA enema, but we can give the enema. You know enema? क्या होता है enema? It's a stomach wash, ball wash. Sorry, it's a ball wash. Google करो. What is enema? You'll come to know. Yes, it can be given in constipation. There could be multiple causes where we can use it. ठीक है? So enema mainly, yeah, it is given in constipation. Please don't talk. But it can also cause local effect. So we are using here for the local effect. For the distal disease, we can give the enema, 5-ASA enema, and this 5-ASA can act locally. So one was we gave it to oral. We gave in the oral form coated ASA, and that coated form can reach the large intestine. Otherwise it was not coated, then it will get destroyed into the small intestine. So we give the coated 5-ASA and that will reach the large intestine and will act there. Otherwise we can give it from the anus, and that may also act there only. We can also give the steroids given in the exacerbations. All exacerbations, steroids are the most commonly used and most effective. In the maintenance of remission, we can give the NSAIDs. Then immunosuppressants like azathioprine, 6 mercaptopurine can be given. These all are immunosuppressants. Suppress the immunity. Methotrexate, it is also immunosuppressant. Dihydrofolate reductase inhibitors. You'll read about it in the anti-cancer drugs. Cyclosporine, it is a calcineurin inhibitor and also decrease the formation of inflammatory mediators. Infliximab, it is a TNF alpha inhibitor, also used in rheumatoid arthritis. It decreases the TNF alpha by binding to it. So, it also reduces the TNF. TNF is a mediator of the inflammation. हमें भी दिखाओ क्या दिखा रहे थे दिखा दो Then some non-specific agents like isabgol, usually given in constipation, but we can also give in diarrhea because it forms the bulk and make the consistency solid. Not commonly used, mostly given in the case of constipation. Okay? Absorbents like kaolin, pectin can be used to bind the toxin, but not used. क्या हुआ? Isabgol is usually given in constipation only. I am saying that it can be given here. It's an adjuvant, can be given to increase the consistency of the stools. अगर loose stools हैं, तो we can give it along with it. In the case of secretory diarrhea, we can give because it will increase the consistency of the stools. Okay, but not used commonly. Resveratrol, I have told you. Bismuth subsalicylate not commonly used, and octreotide. It is a somatostatin analog, decrease the secretions and used in carcinoid syndrome, which is a tumor of VIP. Tumor of vasoactive intestinal peptide, which increase the secretion. That is VIP. Also used for refractory diarrhea in the AIDS. All the secretory diarrhea we can use octreotide. Anti-motility drugs like codeine. It is also a opioid drug and can cause a diarrhea. Thank you.